My name is Sarah Monaco. I am the System Director of Cytopathology here at Geisinger Medical Center, and I am also the Program Director for the Cytopathology Fellowship. I'm also the head of cervical GYN surgical pathology, and I'm a professor in the Geisinger Commonwealth School of Medicine. Our fellowship program in cytopathology at Geisinger is really a comprehensive one-year exposure to GYN and non-GYN cytology, with an emphasis on every area you could imagine within cytopathology, from rapid on-site evaluation of FNA specimens and core biopsies, all the way to sign out with comprehensive immunohistochemical stains, molecular testing. I would say one of the greatest things about our healthcare system is that we really embrace small biopsies and have seen small biopsies just expand, and we play a crucial role in evaluating these biopsies from start to finish. I'm proud to say that we really have extensive telecytology using live streaming in addition to robotic microscopy and whole slide imaging, and this allows us to really provide our services to any patient in the Geisinger system that's having a small biopsy, even though you as a fellow are positioned here in Danville for the entire year and don't need to move to all of our satellite facilities. So that really is a nice way to expose you to a huge healthcare system and how they're dealing with biopsies happening in different facilities without physically moving you as a fellow. And so you'll get an in-depth exposure to what happens on-site in addition to what happens remotely. One of the greatest things about our program is that we do have sort of nationally recognized faculty in cytopathology. There are 5 of our cytopathologists positioned in Danville, and we have another 4 cytopathologists in our Northeast campus. In addition, we have a large group of cytologists who are busy assisting on rapid on-site evaluation and in addition to screening cases. We also have dedicated lab staff on the front end, sort of accessioning and triaging our specimens in terms of preparation. And so the fellows are really kind of intertwined with this multidisciplinary group of cytopathologists, surgical pathologists, cytologists, residents, medical students, and so there's lots of opportunities to engage with almost any subspecialty in pathology, in addition to teaching all different types of learners. Geisinger does a really good job of teaching things in pathology that are hard to learn from textbooks. And a lot of these skills are things that employers are looking for these days. And I would focus on sort of informatics, quality management, lab management. All of those things are very hard to just learn passively from a textbook. You really need to be sort of intertwined with a busy service, seeing all of these different things working together. And I think that that's really one of the greatest things about our fellowship. I can say that that's one of the things that attracted me to Geisinger, was sort of the novel informatics tools it has to do my job as a lab director. We've also modernized our lab information system and done a lot of things to sort of enhance our ability to do patient care. And I think if I was a fellow looking for 1 year with lots of exposure to interesting and challenging cases, in addition to learning the skills that are hard to teach in a textbook, this is the program for you.